Hello, welcome to JRA Global Hospital's webcast series. The name of this series is Don't Hit Rock Bottoms, where we discuss about bottom problems that occur in most of the individuals. So, we'll be breaking it down into different episodes and we'll be educating you about different problems that are there in proctology, and we'll be taking up questions in the comment section as well. So, this first episode is called Breaking Stereotypes, where we address some of the common stereotypes that are being talked about proctology of late. So, mom, let's start with one uncomfortable question. People talk about migraines, diabetes, or if they have a stomach problem as well, but why don't they talk about bottom issues?
Hi everyone. So let me ask you this. So anything to do with our private parts. Okay, so we don't want to talk about it. So it's not really a taboo, but also there's a lot of embarrassment when it comes to this area. So most people, one, they don't have access to it. You can't really see what's going on down there. And that also causes a lot of embarrassment, a lot of shame. So people don't want to confront that issue. So when it comes to bottom problems, people like to assume things about it and then neglect it. So I think that's why people don't want to talk about it openly.
Okay, so let's address some of the common self diagnosis that people in India do. So, if they have a bleeding problem in their rectum, then they'll assume it's piles. If there's pain in the bottom, they'll assume it's piles. If Google says anything scary that it might lead to something more dangerous, then they'll be like, to calm themselves, they'll say, like, okay, it just might be piles or something less than piles. So, how would we address something like this when a patient comes to you saying, Doctor, I might have piles? So, how do we address that?
So actually, this is what all of us do, right? When we're faced with a problem, we want to find the solution. We want to find the horse. We don't look for the zebra. So everybody wants to think about piles because most of the time they are right. So most of the time, all these symptoms can be because of piles. It could be pain, it could be bleeding, it could be swelling. So all these can present as piles. But we always need to be aware of the zebra because you don't want to be that one person who has the unusual diagnosis or the dangerous diagnosis. And you'll never know if you are that one unless you get it checked. So I say that yes, you may have all these symptoms and it may just be piles. But it's better if you get it checked and you're sure that you do have piles and nothing else more problematic.
Doctor, explain me like I am a 5-year-old kid. Why is the bottom so problematic? Why is there a chance of having any kind of serious issue in the bottom?
Okay, so to use a very familiar analogy, I'd say think of your entire gut like the plumbing system of your house. Okay, so if you have your plumbing system which is clogged, your drains are clogged, then imagine your entire basement or your house is getting flooded with sewage water. So that's what we talk about when we talk about the anus or the rectum, the exit point of your gut. So if there is a problem with this, if that is getting blocked or if it has some issues, then definitely it's going to affect your entire body and not just that area. So to break it down further, why does this have so many problems, you ask? Because one, it is something which is constantly under pressure. Alright, so this motion area that we talk about, the rectum and the anus, they are always closed. So the anus works in such a way that 24/7 it is closed. Even while you're asleep, you're working, you're exercising, the way it functions is it works like a gate, a sphincter, which is always shut. And only when your body feels that urge to pass stools, there's getting a signal from inside that it should open up. Again, there are two checkpoints there. So there's an internal gate and an external gate. The internal gate opens without your control. And if you have access to a washroom, then you can go and pass the stools. Otherwise, we shut the outer gate. We shut the outer gate and we control the stools so that it doesn't pass outside. So this internal gate is always closed, and that is a natural high pressure zone. On top of that, there are some bad habits we inculcate, such as straining. When we pass stools, we don't pass stools naturally. We have to strain a lot. A lot of people have this habit of applying pressure just at the beginning or just at the end, where they don't realize that they are causing more strain on the sphincter area, on the rectum. The second thing is the food we eat. So, the food we eat, to continue with the analogy, the water in the pipe has to be clean. It cannot be sludge. If it is sludge, of course, the flow is going to be bit more problematic. So, if your stools are nice and free flowing, if they are not very hard, but they are of firm consistency, they are of not liquid stools, but soft consistency, you'll be able to pass the stools freely. But if they are very hard, stone like, or if they are like small pebbles, then it becomes very hard for you to pass the stools. And then thirdly, the most important factor which a lot of people are facing with right now is a lot of stress. So if you've heard the stress hormones or your fight and flight responses, at this time all the gates in your body, your sphincters shut down. So when you're in stress, the focus of your body is to fight or fly, right? So it's not to relax and excrete. So when you're under stress, it does not allow your natural muscles to relax, because it's pushing all the blood away from digestion to your heart and your legs, right? So when you have the relaxed part, the parasympathetic part working, only then can you pass stools comfortably. So if you're in a high stress job, or if you're under a lot of stress because of your family issues, personal issues, it could be money, health. So whatever the cause, if you're under stress constantly, then your gates are going to shut down and they're not going to open properly, which will lead to physical strain and then of course more problems. So, the other thing that we've noticed is sedentary lifestyle. So I've always said that if you maintain an active body, your intestine will also be active. You must have noticed that in people who are sedentary, who have desk jobs, or people who are bedridden, their normal movement, the motility of the intestine will be affected, because they don't move around as much, so the intestine does not move around either. So all these issues can lead to problems, and as days go by, we've been noticing that these problems have become very common. It used to be quite rare, but with the change in the diet, change in the lifestyle, everything is instant now. You can sit at your home and travel the world. You can sit at your home and have cuisines from any part of the world. You don't need to get out of your chair for anything. That's how convenient our life has become. But that's causing problems to our body.
Okay, so there's another common question that I'd like to address. Is sitting in the toilet for a very long time also gonna cause bottom issues?
See, there are two aspects here. One is sitting on the toilet for a long time. You should not be reaching the loo unless you have the urge to pass loo. So sitting on the toilet, on the phone, you're distracted. Alright, you may be working sometimes, you may be stressed out, so that's not helping you in any way. So what I tell my patients is, passing stools should feel as natural as just brushing your teeth. You get up in the morning, you brush your teeth, you pass your stools, you move on with your day. You don't stand in front of the mirror, brush in your hand, phone in the other, looking at the screen instead of brushing. So that's how it should be. Same thing at night. So you establish a pattern. Only then can it become reflexive. So you wake up in the morning, you wait for the urge, then go and pass the stools. The entire process should not take more than 5 to 6 minutes at the most. So sitting unnecessarily on the toilet can, one, lead to sedentary issues. The other thing is, it can cause you some infections also. A lot of stagnation there on the toilet, not necessary.
Okay, so I have a few questions. We'll just have a rapid fire round about those. So what are patients more scared of, pain or surgery?
I think patients are more scared of recurrence, you know. They're afraid if it comes back. They'll tolerate the pain, they'll tolerate surgery, but they're afraid that it doesn't want that it shouldn't come back.
Okay. Does spicy food causes piles?
Spicy food alone won't, but it definitely plays a huge role in it.
Our do Indian toilets cause piles?
No, on the contrary, Indian toilets or the squatting position is known to be helpful for maintaining a good angle so you can pass stools conveniently.
Is laser surgery just a marketing hype or is it useful?
Laser surgery in the right hands with the good experience can be magic. It works wonders, it gives you great recovery, and it gives us very good results.
Is bleeding dangerous?
Always. So, unless you know what the cause of bleeding is, no matter how little it is or how infrequent it is always important to get your bleeding checked.
So, after surgery, they say that people can't sit or sleep properly for weeks. Is that true?
Absolutely not. So, thanks to the great technology that we have and the different procedures that we have, it is possible to do most of the cases as a daycare procedure. So, we can admit them in the morning, discharge them in the evening, and they can resume work from the very next day.
Congratulations, Mom. You just broke a few myths of WhatsApp University.
Good to know.
Before we close this episode, I'd like to ask you, the audience, a small question. So every day when you guys wake up, you check phone, you brush your teeth, maintain a skincare routine, and check your weight. But have you done anything to check your gut habit or how healthy your gut is? Let me know in the comments what you do to check your gut health. And in the next episode, we'll be talking about constipation, piles, and fistula and what they mean in detail.